Preparing for cleft lip or cleft palate surgery can be stressful and cause a lot of anxiety. I hope that this video will aid in your understanding of the risks, benefits, preparation, and recovery from surgery. Cleft lip and cleft palate are among the most common facial anomalies affecting children around the world. During the first 4 to 12 weeks of pregnancy, the bones and tissues of a baby's upper jaw, nose, and mouth normally come together or fuse to form the roof of the mouth and the upper lip. A cleft happens when parts of the lip and mouth do not completely fuse together. Cleft lip and cleft palate repair is a type of surgery to correct this abnormal development, both to restore function and to restore a normal appearance. These repairs often take multiple stages and surgeries throughout the child's life. A cleft lip is a birth defect that is sometimes just a small notch in the lip. It may also be a complete split in the lip that goes all the way to the base of the nose. It can occur on one or both sides of the lip. A cleft palate can be on one or both sides of the roof of the mouth. It can run the full length of the palate. Your child may have one or both of these conditions at birth. Treating cleft lip or cleft palate takes an interdisciplinary team of specialists, including a pediatrician, nurse, plastic surgeon, dentist, audiologist, genetics counselor, speech therapist, orthodontist, oral surgeon, ear, nose, throat surgeon, social worker, and psychologist. Soon after your child is born, you will meet with a feeding therapist. The therapist will help you to find the best way to feed your child before the surgery. This may require special feeding bottles and techniques. It is very important that your child gain weight and be healthy before surgery. Children with cleft lips or palates have a hard time feeding and have to work much harder to feed than other babies. Prior to surgery, your child may undergo nasoalveolar molding. This involves expanders being placed in the mouth to expand tissues and align the skeleton to make the surgical repair easier. The surgeon will take a complete medical history of your child and do a complete physical examination. In some cases, your child's surgeon may collect a sample of your child's blood and run some lab tests. Always tell your child's doctor what medications you are giving your child. This includes prescribed medications, over-the-counter drugs, herbs, and vitamins. Several days before surgery, you'll be asked to stop giving your child any drug that makes it hard for your child's blood to clot, such as ibuprofen. At your pre-op visit, you will be instructed on when to stop giving your child drinks or food the night before surgery. The surgeon and healthcare team will make sure your child is healthy before the surgery. If your child is sick, surgery may be delayed. The duration of the surgery will vary depending on the type of cleft your child has. Cleft lip surgery is usually done when your baby is around 3 to 6 months old. During surgery, your child will have general anesthesia, meaning your baby will be asleep and not feel any pain. The surgeon will trim the tissues around the cleft and sew the lip together. The stitches will be very small so that the scar is as minimal as possible. Surgery to correct the nose may also be done at the same time. Cleft palate repair is usually done when the child is older, around 9 months to 1 year old. This allows the palate to develop as the baby grows. Doing the repair when the child is this age will help prevent further speech problems as the child continues to develop. During cleft palate repair, your child will again be under general anesthesia. Tissue from the roof of the mouth is moved over to cover the soft palate. During these surgeries, ear tubes may be placed to prevent ear infection. Sometimes a child will need more than one surgery to close the palate. General anesthesia is safe and involves minimal risks. Risks from any anesthesia are problems with breathing, reactions to the medications, and harm to the vocal cords from the breathing tube. Risks from any surgery are bleeding, infection, and need for further surgery. Some potential problems from these surgeries include the bones in the middle of the face not growing correctly. Some babies may develop some hearing loss if they have infections of the middle ear from surgery. Others may have gum problems or issues with tooth alignment. Although outcomes vary slightly, surgery for cleft lip and palate is usually successful and surgical complications are rare. Your child will be in the hospital for 1 to 3 days after surgery. Complete recovery can take up to 6 weeks. The surgery wound should be kept very clean as it heals. Before discharge from the hospital, your child's nurse will show you how to take care of the wound. You will need to keep the incision clean and keep it moist with ointment. It is important not to stretch or apply any pressure to the area for 3 to 4 weeks. Thereafter, massaging the scar will help it to heal. It is important to keep your child from putting hands or toys in the mouth. Your child may be given elbow immobilizing devices for 6 weeks to protect the repair. It is also important to protect your child's scar from the sun. It will take about a year for the scar to remodel and completely heal. To give an idea of the timeline of your child's treatment, as mentioned before, your child will have nasoalveolar molding or tissue expansion between 2 to 6 weeks old. Cleft lip repair is done around 3 to 6 months of age. Cleft palate repair is usually done around 9 months to 1 year old. Revision surgery may be needed when your child starts school. Bone grafting is needed when your child starts to lose teeth. Jaw correction surgery is done when your child is an adolescent. Rhinoplasty or nose surgery is done when your child is a teenager. Some children may require additional palate surgeries to improve speech. Throughout this process, your child will be followed closely by a multidisciplinary team of healthcare professionals. Although treatment extends over several years and requires several surgeries depending upon the involvement of the cleft, most children affected by this condition can achieve an excellent outcome in appearance, speech, and eating. Please don't hesitate to ask your surgeon or healthcare team if you have any further questions. Thank you for listening.